Erin, I am going to share our screen because we can't do what we do
Great.
without our amazing sponsors. So a nice shout out, our education sponsors for the year. We have our presenting sponsors of West, Merck, and Daiichi Cienko, with our supporting sponsors, GSK and Lilly. They are incredibly supportive. We cannot say enough about their commitment to our breast cancer initiatives, ovarian cancer initiatives with integrative care. They are right there walking by our side and really making sure that we are able to get to as many, women, men across the nation to treat. So a big thank you to them. We are most grateful. So Erin, I am going to let you take center stage. You have a wonderful mocktail. We always like to open up our virtual hangouts with a mocktail.
Yeah,
So
yeah.
Erin, what do you got for us tonight?
I am feeling very trendy this evening because for those that may be on TikTok, apparently the younger generation tells me that the Sleepy Girl mocktail is trending right now. I say it could be for anyone, so we're doing the Sleepy Time mocktail this evening, but it's got some interesting ingredients, which I'll talk about and how they can potentially support good sleep. It's really easy to whip together. And maybe this is something that you're just making part of your sleep hygiene routine before, as you're sort of winding down at the end of the day, which could have some positive benefits. So let's get mixing and matching. So the base of our Sleepy Time mocktail is tart cherry juice that I have here. So we're going to be you need a stirrer. We're using about 4 ounces of tart cherry juice. Now, why tart cherry juice unsweetened? There are 2 nutrients that are found in tart cherry juice, which also means they're found in tart cherries, which includes, it's a natural source of melatonin, which is otherwise known as the sleepy hormone. Melatonin plays an important role in helping to regulate circadian rhythm, that sleep-wake cycle. Our natural melatonin levels are highest at night, and that's what allows us to sleep. So potentially this could have some supportive benefits for a more restful sleep. So natural source of melatonin, also a natural source of tryptophan, which is an important part of the body's production of both serotonin and melatonin. So we sort of think of tryptophan when we get tired with turkey at Thanksgiving. So again, could potentially be supportive of sleep. So that's why we're basing this with some tart cherry juice. Now, the other thing that we're adding is a supplement, which I'll talk about because for those that know Unite for Her, we are very food first, but magnesium is an interesting supplement. In fact, it's one of those nutrients that can be considered as underconsumed in a lot of parts of society because of perhaps a lack of food choices. Just a percentage of magnesium that we eat nutritionally is actually absorbed. So the type of magnesium that we use in this Sleepy Time mocktail is a form of magnesium called magnesium biglycinate or B-glycinate, bisglycinate. You can't see that here. Here's a better one. So we'll talk about that. So this recipe calls for a teaspoon. So let me just put this in here. We'll do a little mixing to let this sort of mix up. And I'll talk about magnesium. So it's a really important mineral. And like I said, if you look in any sort of health store, you're going down the supplement aisle, there's all kinds of forms of magnesium out there. So it's really important to know that if you're going to use a supplement, and we'll talk about how important that conversation with your physician before you start any sort of supplement is. But if you're going to start one, you're using this form because research has shown that this bisglycinate, or just, you may see it on some labels as just magnesium glycinate. It's practically the same. It's just the chemical name versus the common name. There's some slight chemistry differences, but they are known to have sort of a relaxing, sort of muscle relaxing effect on the body. Now, other forms of magnesium, because there's lots of different forms out there. So forms like magnesium hydroxide is what is typically seen in milk of magnesia, which we know causes diarrhea, as does magnesium citrate, right? Both are known to be helpful with constipation or could have a laxative effect. Other forms of magnesium are found in products that help heartburn and indigestion, like Rolaids. So you want to make so different forms have different effects on the body. But this form, what we know is that it can have a relaxing, sort of muscular relaxing effect. There is no it's not going to sedate you. It's not going to make you feel tired. But what it does is, again, sort of creates that relaxing sort of experience. So between a natural source of melatonin, a little bit of magnesium, you're putting it in a mocktail. And again, could it create a nice sort of environment or be conducive to promoting good sleep? Potentially. Right? So that's why we're using a little bit of magnesium. Now, for this particular mocktail, really simple, those two ingredients, I have my glass here and we're pouring this over ice. So let me add a little bit of ice here. And then you top it with your favorite sort of fizzy beverage. So this I will pour over ice once everything is mixed. And then I am going to add a little bit of kombucha. It adds a little bit of fizz to it. You could use a seltzer water, you could use a sparkling mineral water, and you can just top that with it to cut that flavor. So I'm using a little bit of a kombucha, eyeball it, one final mix, and then you can sip on this as your sleepy time mocktail. So let's take a sip. Oh, that's delicious. That is tasty. So again, do we think that this sort of mocktail is revolutionary in terms of solving the insomnia problem or the sleep disturbances that often come with menopause and treatment-related menopause? Potentially it could be supportive, but there also potentially could be a little bit of mind over matter, right? A little bit of a placebo effect. If we're enjoying this as we sort of settle in for the night, and we're calming down, we're putting our blue screens away, we're creating a relaxing environment, all of which that sleep hygiene, is really conducive to setting a person up to falling asleep and having more restful sleep throughout the night. So generally pretty safe. Again, magnesium, we don't need to be taking a supplement. You see, I have multiple here. I kind of pulled from everyone I know because, there's lots of different products out there. So one of the things that I also wanted to mention is if you speak to your physician about this, hey, I want to try this magnesium supplement, there's a couple things that you want to be mindful of. One, you want to make sure the quality is there. So you want to make sure that they do quality testing, and there are a handful of organizations that really test supplement quality. So USP offers a supplement certification. There'll be a label, consumerlab.com, NSF International. And then I was reading about another certification based out of London, but OSHA has approved it to be supplement quality testing, and it's called Intertech. So when I was looking at these labels of products here, I noticed that this particular brand, which is a Thorne brand, this is NSF. I see that label very small on, I had to literally grab a magnifying glass. I was like, what does that say? But anyway, it's got that quality seal on it. This has the Intertech quality. So we know that these products are being tested. This one does not. So you want to do a little bit of research so that if you decide, and this goes for any sort of supplement, right? I want to start something. I've talked it over with my physician. I know the appropriate amount. Let me find a good quality product. Also, at the end of the day, remember, there are lots of foods available that maybe you have as a nighttime snack that are natural sources of melatonin and magnesium, right? So think tart cherries, snacking on them as a sweet snack at the end of the night would be great. I've got some pumpkin seeds and I've got some chia seeds here. These are both very, very high sources of magnesium. So there's lots, and a lot of our legumes and nuts and seeds and vegetables like spinach are also good sources of magnesium. So also knowing that maybe you're just having a little evening snack before you settle in for the evening that's healthy, that's delicious. It gives us a little bit of crunch, but also has those nutrients that are conducive to supporting good sleep. So this is a fun little mocktail to try. But again, we've got lots of options in terms of what are the things that we can do to really support overall sleep. So certainly if you give this a try, let us know what you think. Some recipes that I found on social media called for a tablespoon of magnesium, which is a lot. The RDA for an adult female is just over 300 milligrams a day, and 1 teaspoon of most of these gives us about 2 to 250 milligrams. So a tablespoon would be way more than we need during the day. So I always recommend, making sure you're doing a little bit of reading in terms of the quantity that goes in, and also considering those foods that are nutrient dense as well. So not relying on supplements, for example, as our source of magnesium. So just some due diligence on your part, because certainly there's a role for supplements, in certain areas of life, but we want to make sure that you're speaking with your physician before starting anything. You're taking them safely. You're not using them to replace medications unless that's something that you speak again with your medical team on. But hopefully I'm awake by the end of this virtual hangout. So we'll see how good this sleepy time mocktail is. Sue, if it's just a one-time co-host,
so.
I mean, then I feel like maybe we're on to something here. But anyway, cheers to all of you. Hopefully that was a little bit of insight in terms of, how we can really support sleep. I thought that was a fun little entrance into our treatment-related menopause discussion tonight.
Yeah, for sure. I love it, Erin. And cherry juice, you forget about that. Some people use that as a mocktail as well, just to have that instead of your red wine at night. And you have this tart cherry
you could
juice.
mix this and a little bit of like seltzer or sparkling mineral by itself, and it would be really, really lovely. Or you cut it with a little bit of kombucha. So and this is like, sometimes I'll even use this to add a little flavor to my water. Water gets boring. And so I like to add a little splash of juice. And this adds a little color, flavor, and then we get our hydration in as well.
Yeah. Well, Erin, it's wonderful having a doctor in the audience because she's answering our questions for us. So we love that. So
love that.
You, Dr. Singh. Thank you, Dr. Singh. And then the other thing I had was just one question. The magnesium breakdown that you gave us, I love that you sort of took us into 3 different categories of magnesium and how they're different. And I know that some of our community too, they experience some leg cramps at night, feet cramps, the muscle relaxing. So would this also be good for that, Erin?
Yes. So actually one of the studies that I was looking at has looked at this particular form of magnesium, the glycinate or bisglycinate, for restless leg syndrome. So there is some support to helping that muscle relaxation, potentially helping with comforting something like restless leg syndrome. So absolutely, from a muscular standpoint, it could potentially be helpful.
And then are you taking that vitamin at night to help with that? Or is it okay if you take it as your regular routine? Okay.
I would say take this closer to the evening. And even for this little mocktail, they suggest taking it 30 minutes to an hour before you sort of head in to fall asleep, which is usually the same recommendation for even if someone were to just take a melatonin supplement on its own or just have some straight cherry juice, because of how the rise of melatonin happens as we sleep, that, as it kind of moves through the digestive system, that can help to keep that level sort of on the rise and elevated to help a person stay asleep.
Wonderful. Awesome. Yeah. All right, Erin, that's a wrap. Thank you very much. Your February mocktail. Yeah.
Oh, I'll be sipping. Yeah. Thank you.
You got it. You got it. All right. So now it is with my great pleasure that I get to introduce Dr. Singh, and I am going to introduce her today. She's been with us a few times now. Dr. Singh is a women's health advocate and an integrative gynecologic oncologist. Dr. Singh received her medical degree from Northwestern University and a master's degree from the Harvard School of Public Health. She completed an obstetrics and gynecological residency at the Johns Hopkins Hospital and a gynecologic oncology fellowship at MD Anderson Cancer Center. She completed her doctorate degree in public health on cost analysis at the University of Texas School of Public Health and has an associate fellowship in integrative medicine at the University of Arizona. Hence why we have really brought her onto our team for that. She is a long-term member of the advisory board for FORCE, Facing Hereditary Cancers Empowered. They are also one of our partners, so you may have seen those speaker series on our library as well. and the Board of Directors of Physicians for the National Health Program. So, Dr. Singh, thank you so much for coming out. We appreciate you. We know that this topic is very important to talk about. I feel like we wanted to get started by talking about menopause and how we view it, because we're understanding that for those of us joining us today and who are going to be watching in the future, treatment-related menopause is tied to a significant health diagnosis, at some times, and it shouldn't be downplayed whatsoever. And the word menopause by itself is always just, negative connotation innately. I would love for you to open us up there, level set us, speak to that. And yeah, maybe we could start with that.
Happy to. I'm so happy to be with you guys. My dog is kind of worked up tonight, so I apologize if she's barking. She'll do it now and then. Usually I just think she's like greeting the neighbors. That's what's going on. So just real quick, I'm gonna go backwards. Somebody asked about, is glycinate preferable for sleep and calcium absorption? All of the magnesium forms help with calcium absorption. It's just about being like a positively charged thing. The glycinate, I mean, for me, it depends on what's going on with someone. If somebody has a little bit of constipation or bowel issues, sometimes the magnesium oxide and citrate is better. I like the glycinate because it has the fewest other side effects. But sometimes magnesium oxide is a little bit less expensive and easier to access and available in most hospital pharmacies. So the calcium and potassium absorption part's the same. So yeah, I struggle. So we're talking about treatment-related menopause, which is not the same as naturally occurring menopause. But I think the connotations around menopause and aging for women are challenging in our society. And I think while for men, we tend to associate, a little, gray hair with wisdom and stability, somehow we haven't carried that over to women. And I do think we just need to think and talk about it differently. That menopause is a natural part of life, and that for many of us, if we go through menopause naturally between say 45 and 55, and the average lifespan in America now is somewhere between 87 and 93 for women, that means you're going to spend half of your life in menopause. And so thinking about how to have the best quality of life during that time, and how to not think of it as the end of life, as opposed to the middle of life, which might be more accurate. And also think about, the benefits potentially of no longer cycling and not having the same hormonal shifts we dealt with before, and not worrying about things like contraception anymore. I don't know. I think we all have to do that work of shifting how we think about aging for women, and for why menopause has become negatively connotated. It used to be that, we talked about, the maiden, the mother, and the wise woman. And in some cultures, the term wise woman was changed to crone, but then crone had a bunch of negative connotations. And so I don't know, I think it's the work we do. Treatment-related menopause, of course, is something that happens earlier, and is unexpected and doesn't necessarily unfold in a natural way, and so has a different set of challenges associated with it. But just like we talked about during the talk, was it in October? I think it was in October, right? That we had our, there's a lot of overlap in terms of symptoms and side effects, and in terms of the ways we deal with things. And so just so I'm not talking to everybody and we're doing a back and forth, I think we had some questions that people had already sent in to us, and Sue and Erin, if you guys will share those with me, we can get going.
You got it. Yeah, we do. Erin, I can get started if you want. So here we had one that said estrogen, it has a lot of roles. Do you want to just start by talking about that in general for our audience, about our roles of estrogen?
Well, it's very interesting. Estrogen and the roles it has evolved even since, I finished medical school in 1991. And at that time, we really only thought of it as, what it did in reproduction. And we were starting to learn that it was part of bone health, and we were starting to explore osteoporosis and the connections there. And as we learned more about breast cancer, really, we started learning more about where estrogen mattered. And as we've learned what estrogen receptors look like, and we've learned to do better studies, like we have estrogen receptors everywhere, right? We have them in our brain, we have them in our skin, we have them in our heart, we have them in our bones, in addition to having them on our ovaries, in our uterus, and in all the different cells of the uterus. So estrogen plays a role that's quite varied. And generally, we think of it as something that stimulates growth in the endometrium and the lining of the uterus. It stimulates growth, potentially on the surface of the ovary, certainly in breast tissue. But it seems to be much more complicated than that. You know, I mean, just, you know, being proud of my age, 56 years old, you know, again, when I went to med school, there were some ideas that hot flashes weren't real, right? That they were totally, we used to call it a cultural thing. Now it's just, you know, people think they're having them, but they're not really. Now we know that there's a receptor in the brain, right? For a specific neurotransmitter that is impacted by that receptor is also impacted by estrogen. So it's not just estrogen receptors that estrogen works on, right? So all our hormones are way more complicated and interactive. And I love, Erin, you introducing a talk, and maybe you did it on purpose, maybe you didn't, but there's clear relationships between melatonin and estrogen. And having melatonin deficiency be one of the things that puts us at risk for getting hormonally mediated cancers, again, because we think the structure of melatonin is similar to some of the hormones and similar to some of the brain hormones that get our ovary to make estrogen.
Interesting. And so with all of the varying roles that estrogen plays and how it's so connected, like you said, even just learning that it's connected similar to melatonin and you know, how they can potentially sort of assist one another. But, you know, with our community, when someone is or knows that it's coming, right, I'm going to eventually have to start hormone therapy, or is that a guarantee that they're going to experience some sort of symptom? Like, is that typically to be expected, or, you know, or is that really varied for one reason or another, you know, just sort of based on the person, kind of?
The symptom, absolutely, the estrogen withdrawal symptoms are individual based.
Okay.
Right. And we think that's, again, about our own body chemistry, about our own genetics, you know, as in the stuff we were born with, you know, people who have bone loss versus, you know, people who don't, people at risk for osteoporosis versus not, right? So there's general things we can say, but certainly like hot flashes, not everybody has hot flashes. Of the people who have them, for some people, they last 6 to 8 months. For other people, it's 3 or 4 years. For other people, it's 10 years. And for about 10% of people, they never actually go away. And so, yeah, unfortunately, we're all individuals and all different. But that does become one of the challenges of dealing with side effects, is that, you know, what's important and a meaningful side effect related to menopause to one person may be something different to another. And that's also what helps us make choices. Like, just like how we were talking about the magnesium, if, you know, muscle cramps are an issue for you, or constipation is an issue for you, make different choices. If for someone in menopause, their biggest symptom is hot flashes, then maybe some of the actual prescription medicines might be worth the side effects, versus if the biggest one is sleep disruption, then maybe we have some different choices to make. So I do think thinking about what's happening to you is probably the biggest part of making choices about what treatments or therapies you might undertake.
And I think, you know, one of the things that I often suggest in it, and it sounds like, you know, you're alluding as well, is really keeping that conversation with your physician open about what you're experiencing and how your quality of life is or is not affected, so that you can sort of gauge how that process moves forward, and then can have a really thoughtful talk about what could you do, what can you try, not even just medications or supplements, but, you know, movement, meditation, acupuncture, these other therapies that can really work to at least soothe some of what a person is experiencing.
Well, and I think the other challenge talking, as we are to people going through cancer treatment is sometimes it can be hard to separate out. So what
Mhm.
symptoms am I having because I'm getting chemo? What symptoms am I having secondary to losing ovarian function? What's related to what? Is the anxiety coming from estrogen withdrawal or is the anxiety coming from the other medications or my worry about what's happening with cancer or my finances, et cetera? Or, are they all happening? Right. And so
Yeah.
I do think, that's what makes treatment related menopause so much more complicated for
Yeah.
people is
Yeah.
because it's happening when there's so much other stuff going on that sometimes it's hard to separate.
Yeah.
I do want to quickly go back. I had a person, one of our attendees, message me. I want to make sure we're clear on the relationship between estrogen and melatonin. I don't want to create thinking that like we shouldn't have melatonin. It could be affecting our hormone levels. That is not the case. Or
No, no,
I just
no.
want to provide a little bit more context to what you're saying.
Yep. So one of the things we've learned is that it seems like breast cancer, endometrial cancer, and prostate cancer, we are all associated with professions that have I'm sorry, there's ways I hold my hands that makes my
Me
Zoom do
too.
balloons
I
like
always get the
right.
fireworks,
I
Dr.
think we're
Singh.
like always celebrating and the Zoom just interprets us that way. I celebrate the group we have tonight.
The whole
But
whole party going on.
so we started figuring out that chronic sleep deprivation, that night shift work, seemed to be associated with a higher risk for hormonally dependent cancers. And that was kind of the first thought process that started to get us to say that it seems like there's something about melatonin insufficiency that might be putting people at higher risk. So they are in the same class. Melatonin is in the same class as follicle stimulating hormone, but it's not an estrogen. So taking melatonin is not giving you estrogen, but thinking about not having enough melatonin. And there's a guy who still writes about it. Some of his books are gotten old. I can't think of his name off the top of my head. It'll come to me as we talk. Um, uh, he talks about melatonin deficiency just based on, like we said, blue screens. Like it's getting dark outside. Meanwhile, I have lights on, so my brain doesn't think it's time to make melatonin. And so no, we think that there's a lot of chronic melatonin deficiency that we all have because we use lights that prevent us, prevent our brain from going into sleep. Now we do this for a reason, right? Like we don't have the luxury of sleeping 12 hours during the winter hours, which maybe is what would be more natural to us if we were listening and not having electricity to turn on lights. But so that's where there are some connections, but they're not so direct as melatonin is estrogen. Absolutely not. But I'm just going to say on the things that we think are estrogen, we've also misjudged, right? So early on, we started looking at soy really carefully because we knew that there were these cultures that had a lot less breast cancer than us. And we were saying to ourselves, like, what is different about those cultures? And one of the things that we kept finding in the Japanese and the Chinese cultures where we were seeing a lot less breast cancer was this high content of soy in their diets, where that was one of the main sources of protein. So we started studying it, and lo and behold, we find out that soy is like a phytoestrogen. And so it's having some estrogen effects. And meanwhile, we were doing this very black and white thinking about estrogen receptors and thinking like, well, if something stimulates an estrogen receptor, it must be bad. So no soy, almost ignoring the stuff that made us start paying attention to soy in the first place. But those people were getting less cancer. And so what we're finding out is that the receptors and how phytoestrogens, which are in soy and beans and lentils, and have a really different interaction with those receptors. And the vast majority of data suggests that, especially like food sources of soy and lentils and beans and phytoestrogens, like flaxseed, that they don't seem to have a cancer stimulating effect. And actually, in some of the biggest studies we did in China, in women with estrogen receptor positive breast cancers who were taking tamoxifen to prevent their breast cancer from coming back, if they had 3 servings of whole soy in their diet, that the tamoxifen was more effective for them, right? And so, you know, can I give you guys like a cheat sheet on like, you know, how to do it right and what estrogen receptor does right and wrong? And I can't, because we don't have it. But what we know is food sources are safe and potentially beneficial, and then have other benefits associated with them. And then I'm careful about like the highly processed soy in terms of powders and burgers and jars of things that are called, you know, soy things. Now, there is a product out there called S Equal that is a soy derivative that seems to be pretty effective for hot flashes because of the way it interacts with estrogen receptors. And so far, the research around it doesn't seem to show any connection to stimulating breast cancer, but it's kind of new-ish. Like the other issues around soy are genetically, not all of us break down soy to the active parts to equal. So genetically, it's more common to be able to break down soy well if you're of Chinese heritage or Japanese heritage. And so one of the reasons they've evolved this form of equal is because we don't need to have that genetic ability to break down soy. So I haven't decided yet. I'm still waiting until we do some bigger, better studies on S Equal, the product, in terms of recommending it to people who have estrogen receptor positive breast cancer, because again, that's way different than having tofu, you know, at lunch and a little soy milk with your coffee and, you know, maybe some edamame as a snack before bed. Like that's a really different undertaking than taking S Equal, which is, you know, it's still not that much. I use it a lot in people without hormone receptor positive breast cancers and have and ovarian endometrial cancers. But I'm not totally sold yet. I think most data is going to tell us it's safe. And I suspect because that product has now been out for a few years, it's been in Europe and Asia for, I want to say 3 or 4 years. So we should start getting data, at least European data soon, on its safety in people who have estrogen receptor positive cancers. I thought of another question,
Yeah.
but I lost it. Other
Well,
thoughts?
Dr. Singh, we actually, yeah, there are. Amy was just in, since we're talking about soy, Amy was just wondering if soy was also beneficial if she was taking aromatase inhibitor.
Soy as a diet, in your diet, for sure. You know, the reason the studies were done with tamoxifen was simply because it was before we were using as much aromatase inhibitors. It was kind of early in the life cycle of aromatase inhibitors. Why they looked at a lot of those, like they weren't studies that were done, they were retrospective. People happened to be eating this and taking tamoxifen. Could it potentially help aromatase inhibitors work? We're not sure. So one of the things we know, right, is that tamoxifen is a selective estrogen receptor modulator, which means it turns some estrogen receptors on and others off. Tamoxifen clearly turns off estrogen receptors in the breast, and we think that's why it has beneficial. It turns them on in the bone, in the heart, and in the endometrium. Why there's a higher risk of endometrial cancer associated with it. Like aromatase inhibitors kind of work in a very different way. So we don't know if soy would potentiate it and make them more effective in the same way.
Great, thank you. We did have another question from Annabelle. So she you know that there's numerous health concerns, cardiac and bone health, for women who have gone through surgical menopause prior to going into perimenopause or menopause. And for her, it was at 39. I know for me, it was at 39 too when I was diagnosed. So, what can be done to help prevent those issues?
So it, like it's all of the pieces. So the bone health to me, is the biggest one. And, we know having enough calcium and with good absorption intake, having a good vitamin D, ideally between, I think around 50, having a level around 50, weight bearing exercise clearly protects our bones. And then, we used to do bone density studies all the time. Now we're doing them a little less often. But anyone who goes through menopause that early, should get a bone density study. And then based on where that test is, kind of come up with a plan for the next. One of the mistakes we made early on, which is a mistake we frequently make in Western medicine, was, we started giving people pretty aggressive therapy when they had a bone density study that just showed a very mild thinning of the bone, what we call osteopenia. And osteopenia itself has never been connected to hip fractures or anything. And so we started giving people these Fosamax and Atilda, these medications that have stomach irritation and other long-term side effects. And so what we're kind of learning is, we don't get a bone density study, but then don't over-treat based on it. Use it more to learn. Now, if someone has osteoporosis, absolutely, there's reason to be treated. Talk to your doctor, and they'll recommend different therapies. But to prevent, for someone who's gone through menopause early, that enough calcium and vitamin D and the bone weight-bearing exercises are the most important. A lot of people ask me, like, doesn't it make sense that yoga or running or other things would have the same benefits? And in a way it does, but for some reason it hasn't played out that well in the literature. And I'm a huge fan of like everybody owning like a little set of light weights, even if it's 1 pound, 2 pounds, 5 pounds, or even one of those you can get, one where you could switch the weight, by moving that. I have one of those. And just doing like a 20-minute routine, and it doesn't have to be like, oh, I'm doing my like bicep curls. No, you can do like a little routine while you're, just came in from your 20-minute walk. You just danced around the house for 20 minutes to get your 20 minutes of cardio, and then you just do a quick. And there was a lot of very nice, like if you look up 20-minute lightweight routine, or I want to do it 3 times a week, so I'm going to do upper body and legs, and it's easy to look up those. So thinking about like light weights, and then isometrics where you're using your own body weight, like push-ups.
I will say, Dr. Singh, one of the things that I learned from our speaker series with you was when you talked about just how effective weight-bearing exercise is on bone density, even more so in some situations than medications themselves. And so that has always stuck, and it's something that I always bring up and share with our community when we do our nutrition consults. It really like hit home. That's like, oh my gosh, there's things that we could do at home. There's things that we can make accessible that really are impactful, especially with long-term effects like bone density.
Yep. And I mean, I don't know, you have to like, I play all kinds of tricks. Like I have my little weights like right on a little thing right under my TV. So if I'm looking at my TV, I see my weights. And I'm like, oh, I guess I'll just do it since I'm here and since they're here. But I'm glad to hear that. And the other reason I love weights is I think the metabolism shifts we see between the stress of cancer, early menopause, and the weight gain, the steroids we use around chemo and other things, all of those things. There's also some decent evidence that weight bearing is an important part of an exercise routine to help with weight loss. That cardio on its own is not enough. And again, it doesn't need to be like this crazy, like, oh my God, I'm lifting weights for 90 minutes and I'm like, it can be like those interval things where you do a little jump around, then you do a set of weights, and then you do a little cardio, and then you do a different set of weights, triceps or whatever. And if you look up you know, it's funny, they have these high intensity interval trainings. You don't need high intensity. You know, even if you just look up interval weight routines, or moderate intensity interval, you can find some nice 20, 30-minute routines. But I think that's another thing that a lot of people struggle with. And it's based on some of the metabolic changes we undergo that may be related to lack of estrogen, but may also be related to, you know, the cascade of things that happens, both during natural menopause, but especially when people are undergoing treatment. And, you know, you were talking about your lovely cherry tart cherry drink having a placebo effect. And I feel like placebo to me is a word like menopause. Somehow we've like got negative connotations with it. I don't think of it so. It's like placebo effect so much as like mind body medicine. Like we're telling our body we're getting ready for sleep and it's listening to us and it's turning down our adrenaline and it's turning down our cortisol. And I think that's one of the really hard things that people deal with when they go through cancer treatment is you are in a perpetual state of fighting the cancer and dealing with the side effects and dealing with the, you know, issues that are coming up related to it and the finances. And there's just such a making sure everyone in the family is okay with you going through cancer. Like I think the chronically activated stress, you know, fight or flight nervous system that people turn on when they go through cancer care is a huge part of the side effects that we see and of the weight gain that women deal with, because that, you know, fight or flight is a state of being where your body is thinks it's under attack, which in multiple ways it is, but it doesn't break things down. It doesn't do cellular repair. It doesn't digest. It doesn't reach out to, you know, the energy stored in our fat cells. It starts using our glycogen and our short term because it thinks it's being chased. Yeah, I mean, I think that remembering how that whole nervous system part of us is engaged in all of this stuff is an important way of thinking about it. And again, like, not that I'm like gonna beat the dead horse of exercise, but like, right, exercise also, when we do it to take care of ourselves, somehow it turns off our fight or flight nervous system, right? You'd think like, oh, of course, exercise must turn it on. No, it does the opposite. It turns off our adrenaline, it turns down our cortisol. For many people, like at the end of a Zumba class, their cortisol is lower than at the end of driving home from work.
Wow.
Right? Right?
So
Like
interesting.
right?
Yeah.
And you wouldn't think that, but then you think it like, of course, Zumba's fun. You're there
It's
with
giving you,
friends, there's
yeah,
music, right? There's
it's giving
all
you
the things that turn
balance.
on, right? And
Yep.
there are all the things that turn on our parasympathetic nervous system. And when we do exercise like that, where we're breathing out longer than we're breathing in and giving ourselves that chance, that's another message to our body that we are not under attack, right? When we have a time to do that long expiration.
Yeah. So when you,
So you know what time is it? We're almost can we just do that? Can we just do, we're going to do like a couple, 4, 7, 8 breaths. Let's do it. All right. So at my talk I did. So if you guys have not seen it, the video of the 4, 7, 8 breath that Andy Weil does is very nice. Lots of people do it. It comes from a tradition, from Ayurvedic tradition. You breathe in through your nose for a count of 4. Then we're going to hold it for a count of 7. And when we breathe out, we're going to put the tip of your tongue behind your teeth and you're going to purse your lips. So, right? So in through the nose for 4, hold for 7, out through the pursed lips, that tongue behind your teeth, if you so choose, for a count of 8. All right. Empty your lungs. We're going to breathe in, 2, 3, 4, hold, 2, 3, 4, 5, 6, 7, out, 2, 3, 4. Yeah, make that pushing sound. 6, 7, 8. Breathe in, 2, 3, 4. Hold, 2, 3, 4, 5, 6, 7. Out, 2, 3, 4, 5, 6, 7, 8. So ideally you do a cycle of 4 of those. when you first start doing it, some people feel a little lightheaded. So I'm not going to do it to you guys tonight, but like if you can work your way up to that set of 4, and then, knowing you're doing that diaphragmatic breathing when when we breathe out, we're like pushing out, not like skinnying up, right?
Yeah.
So using that diaphragm as part of our expanding our lungs and then emptying our lungs.
Yeah. And I would imagine that that's also a technique. We hear like, in the middle of the night, someone may wake up, their brain is then running, they can't get settled again. So even sort of tapping into that sort of breathing can help to sort of, kind of calm things down a bit in those
Absolutely.
midnight hours, those
right.
early morning hours.
That turning off your adrenaline, which turns on when we wake up, and maybe we're startled, maybe it was a symptom, maybe it was a hot flash. But the other part, just to be straight up, like I'm someone who has a hard time turning off my thoughts once they start going. And I'm not like somebody who can really sit still and meditate. And so for me, the counting forces me to not be thinking about something else. Right.
Oh.
Right. Like,
So like
when
an
I'm
audible
counting,
count.
like I have the actual count. So I have to stop like being like, oh my God, did I finish that? Did I turn this off? Did I, like, and so I don't know, the 478, I have found, for me personally, and for a lot of people I've worked with over the years, maybe it has the deep Ayurvedic meaning that it, does, but I think at least, the counting, the diaphragm part, I find it beneficial for a lot of reasons.
Yeah. And it's something that we can all do. Like you said, it's a very tangible, manageable thing. And it's good to hear, certainly the shift in weight is something that comes up a lot. I'm asked a lot, like, how do I have to eat? What's my nutrition I need to do to help me get to a healthy weight, lose weight? But it's really nice to hear you also reminding us that we have to address sort of the nervous system. That is just as important as perhaps looking nutritionally, exercise, movement, sort of all of those elements hold equal weight, so to speak.
Yeah, well, I mean, absolutely. And I honestly think the nervous system is the first place to start. But the thing with eating is so hard because I think we've set up all these weird things around food that are not true. Just, like, and I know, like, I have them in my own head, right? Like, God, I'm going through something really hard and I'm having a really bad day. And so what do I really need is like a cupcake. I deserve one. I worked really hard. Right. And the weird part is like our society sometimes somehow tells us that. Like we see, oh, I've had a long week. So where am I going? Fridays. I'm gonna eat some fried food with a bunch of carbs thrown on top of it. And that's what I'm giving myself because I deserve it. As opposed to like, but those are not inherently nourishing. And how did we like make like Brussels sprouts like something to be like dreaded, right? And
labeling,
I mean,
it's that labeling of like good,
it's labeling,
bad.
it's like somebody's invested in selling burgers, and so they're gonna tell a certain story, and somebody's invested in selling Captain Crunch, and so they're gonna tell a certain story. And I guess like the guys who sell apples just don't do enough good ads. I don't know what to say about them. But like if we could almost change our thought process of like, pomegranates are kind of expensive. I did have a crappy week and I'm getting myself some pomegranates. Like how do we change how we think about those things? And so I kind of struggle with food in that sense that like when your sympathetic nervous system is on and when you're stressed out, we crave carbs. But I think we crave like what we've been told to eat when we feel hungry, as opposed to like, no, what our body really needs is a little bit of protein, a little bit of fat, and a little bit of carbs mixed together when we're low on energy, because that's what will actually give us an energy boost. Like that combination of the little bit of everything, right? But somehow like, nobody's shown a picture of like, celery with peanut butter on it when they think they're, needs a snack. to give them energy. Somehow we've connected like, oh, I need a bag of M&Ms when I need energy, as opposed to like, no, M&Ms are just going to turn on your insulin, and then they're going to suck up all the sugar in your bloodstream, and then you're going to be tired.
Yeah.
Yeah. So, yeah, I think we talked about this in October, and you and I, Erin, I know have talked about, the other challenge around eating is then we make lists for ourselves of like, okay, I guess I'm not allowed to eat cupcakes, and I'm not allowed to eat this, and I'm not allowed to do that, and I'm just going to put it more and then not. And maybe even shifting the language on that and saying,
Yeah.
in the perfect world, you eat 5 to 7 servings of vegetables and fruits every day. And so, as opposed to like worrying about what you're not supposed to eat, let's worry about the good stuff you need to get in you. Did you get an omega-3 fat today? Oh, you didn't? Well, maybe you need to grab an avocado or some walnuts or something else, right? Like get your omega-3 fats. Oh, wait, did you get protein in this meal? Okay, you didn't. So maybe it's time to get your, I love some of the new nut butters they have out there that you can get in a little package and just carry around. And like some of that stuff is finally like working its way into our food supply, that you can get things like that.
Yeah. And so much of this is so much about perspective and learned behaviors, or like what we've been taught and how we view. And right, it's like, when we think of food and health, our brain goes to that, the quote unquote bad, the thing, all of that, taking away sort of perspective. And I mean, I could not agree with you more. It's like oftentimes we don't even think about, am I getting my omega-3 fats in? Am I getting my fruits and vegetables? Where'd my fiber come from? Am I getting my hydration? Like, we totally miss that boat because we're so honed in on, well, I can't have this and I can't have that. Like, and then again, let's shift perspective. And I think that just makes nutrition and wellness and sort of having control, it just makes it more reachable. I feel like more approachable, not so negative, I guess.
And then I think the other thing is that our bodies are constantly changing, right? We ate differently when we were 5 than when we were 15, 25, 35, 45, 55. And to be like, oh, I was always a breakfast person, I must, blah, blah, or I was never a breakfast person. Like, I think the other part is like listening to who we are now, like maybe just really like being aware of like, okay, it's morning. Am I hungry? I'm going to try this. I'm going to try like a hard-boiled egg. Okay, that didn't really work for me. I'm going to try this. And was that enough? Or protein shake or whatever. And I think, the people who tell me like, wow, they were grazers their whole life, and suddenly intermittent fasting is working for them, and vice versa. Like, I used to only really eat dinner and go the whole day without really eating, and now I need to eat all day. Like, listen to our bodies, because that might also help us. And kind of getting into that state of being where you're like starving and tired, like, is the worst, because then you really are going to eat anything that's easy and fast and not be thoughtful about what you eat. And so I think like slowing down and making notes and paying attention to kind of, you know what I mean? Like, how hungry am I? What satisfies my hunger when I feel like this? Do I need to change my day a little bit so I actually can eat lunch, because it doesn't work anymore for me to suck down a protein bar or whatever it is? Like, I think that part of accepting our physical, potentially age and or treatment related changes is part of it also.
Yeah. So much to it. It's not a straight line. Oh, go ahead, Zoe.
Well, there was one question. I know it's 6:00 and I just didn't want to miss it. And we're going back a little bit, but it was just about tamoxifen. And I just want this to be clarified for Kelly. She was saying, if tamoxifen turns on estrogen receptors in the bones, does it make us more susceptible to bone metastasis? And I just want to make sure that you're answering that question.
Not that we know of.
Thank you.
Yeah, bone mets are really complicated. And, the things that seem to work to treat bone mets are unclear too. But for people who have working ovaries and estrogen receptor positive breast cancers whose oncologist has told you that there's a benefit to tamoxifen, that I wouldn't put that into the list of worry.
Yeah.
That it increases the risk of but it is kind of interesting, right? Because there are those challenges associated with aromatase inhibitors of bone loss and the accelerated bone loss that we see. I know it's 6 o'clock and I'm going to launch up into aromatase inhibitor side effects, but I'm not. We'll save that
We
for another
cover it in the
day.
speaker series. You did a great job. I will say we cover it in the speaker
Yeah.
series. So you
Yeah.
definitely got into it there. Yeah.
Yeah.
Perfect.
It's good. I'm glad you bring up exercise a lot too. I saw in the chat some of our members like to, share what they've been able to do and what has worked for them. And just keep in mind the ones that are part of our passport and holding our passport actively and are still, they're not expired. We do have something that is a fitness online. It is Stronger Through Cancer. They're one-on-one sessions. They can meet you where you are. And know that, that's so important to get that personalized, look at fitness and what can work for you. So I know there was a little bit of interest in how we can continue to move and how important it is. But know that your passport would be able to cover that and that we would pay for those fitness memberships that are online for you. So Dr. Singh, it was really great to have you. Thank you so much for
Always good to be
sharing.
with you guys.
Yeah,
Always
it's
great to
always
be with you
such
guys,
lively.
and yeah,
Yeah.
appreciate everything you guys do. You're the best.
Yeah,
I'm
it's
trying
such
that
it's
mocktail.
I'm
no,
still
I
awake, but
agree.
I'm feeling relaxed. So I
Awesome,
don't know what that
awesome,
says.
perfect. All right. Well, good
Yeah,
night,
well,
everybody.
Thank you.
yeah, thank you so much. Well, Erin, that is another wrap, right? So it's so good to have these very important topics. I think we always want to share with our community too. Please keep in mind that talk to your physician, talk to your medical advisor. There's so many different nuances and personal issues that come into play when we are talking about diagnosis of a menopause that's medically induced, and keep those conversations open. And
Yeah.
this is somebody that is an advisor of ours. If you have any questions, we certainly can shoot them her way, even after this speaker series. We're always open.
Yeah, I love that. And it's just nice being able to, like we said, have this conversation and be able to kind of, think off the cuff and ask those really great questions that we got, just open discussion. So hopefully you found this helpful. I posted the link to the speaker series. Like I said, we did a lot more of a deep dive from an educational standpoint about treatment-related menopause. So definitely check that out. A lot of good information shared and lots more to come, especially through February. We're planning the next several months, Sue and I, so lots of great topics to follow up with as well.
Yeah, if you guys have any topics that are of interest to you, please let us know. Shoot us an email. Easiest one is info@uniteforher.org, and tell us what you'd like to hear, because we will find advisors and experts that will really cover the topic and give you the best up-to-date information. With that being said, we can't, help but thank our sponsors once again. So our education sponsors, we're very grateful to them, and our presenting sponsors are West, Merck, and Daiichi Sankyo, and our supporting sponsors being GSK and Lilly. So a big shout out to them. And then Erin, you want to take us home with a couple reminders on what we have coming up tomorrow and the rest of February?
Yeah. Yep, wonderful. So again, tomorrow night we have our speaker series for Black History Month. Frankly, we just have an outstanding panel discussing mental health in the Black community, but also diving in to ecotherapy and EMDR, which I think is something that we can all learn something from. I am super excited to learn more about them. So please join us tomorrow evening, 6 p.m. Eastern time over Zoom. You can register for that. That is on our website, uniteforher.org. And then our Ask the Experts, the very end of the month, the 29th, 1 p.m. Eastern time, streaming live on Facebook. We are tapping into our sexual health counselor, one of our providers on our list, talk about relationships, intimacy, dating, all of the things, that we don't always talk about. Submit your questions. Everything is anonymous. So even if you're not able to make it, we'll record it, and we'll be sure to get your question answered as well. Pardon me. So be sure to check that out at the very end of the month as well. So good things to come.
Yeah. Well, thank you, Erin. I always love being here and being your co-host with you. Again, I am Sue
Thank you.
Weldon, Erin Pellegrin. We're always happy when you join us, seeing all those smiling faces. And Dr. Singh, A+. Thank you again for coming out. We appreciate you.
Thank you. Yeah. Oh, thank you. Thanks for coming out, Laura. Good to see you.
Yeah. Thank you, Laura. Good to see you, Tiffany and Allison, Tracy.
Yeah.
Have a good night, everybody.
Have a great night.
Good night.
Good night.
Love all the
Thank you for the
suggestions
love
too.
there, Tracy.
Yeah.
Yeah.
And thanks for
Yeah.
sharing. I love to hear all the suggestions and sharing and commenting and agreeing
Yeah, we
and
love
just
it.
the connection
That's
in
what-
the community.
Yeah, that's what it's all about, right? I mean, we want to share resources that we find to be approachable and something that's worked for us. And then, ask the questions to make sure it works for you as well.
You got it. You got it.
All right, Erin, you got a big date night tonight, so you better get moving.
We shall continue, but this is a great way to start it.
All right. Good night, everybody.
Good night. Thank you.